This part of the course is called Med Instead of Meds because it looks at how we can prevent and control chronic diseases and promote overall health by eating the med way instead of focusing on medication to address these issues. We're going to be talking about what it means to eat the med way, why we should eat this way, and how we can do it. Two-thirds is the portion of chronic disease that can be prevented by lifestyle change, particularly diet and exercise. Research has shown the connection between lifestyle and chronic disease for quite some time. It has also provided insight into some of the ways to move people in the right direction for making lifestyle changes that can decrease their risk for chronic disease or help treat it. However, we will see the number of people with chronic disease rising. You may hear some of your patients say that eating this way is too hard or too confusing, or that eating some of these foods is too expensive. Or that maybe it doesn't taste good, or they don't have enough time to prepare, or they have limited cooking skills. For all these reasons, people can feel stuck when it comes to eating healthy, but it doesn't have to really be that difficult. Considering all of the above reasons why people feel stuck when it comes to eating healthy and all of the available research related to healthy eating, we're going to try to break down what we should be eating in the next couple of slides. You'll see it really doesn't have to be that hard or complicated. We really just want our patients to eat this, and this, and a lot of this, and some of this, and a little bit of this. But mostly eat this. Not complicated at all. This doesn't have to be hard or daunting, and anyone can do it, and it can be absolutely delicious. Let's talk about whether we want to use PANS to address chronic disease or whether we want to use pills. The med diet can reduce cardiovascular disease, diabetes, and metabolic syndrome, especially when compared to a low-fat diet. We have options in how we can approach chronic disease prevention and control in our society and in our lives. So do we want to use the foods we eat or use a pharmaceutical intervention? This is not to say that they cannot be used together or that pills or pharmaceutical intervention has no place in modern medicine. We're just saying that the med instead of meds, eating the med way instead of relying on just medication to reduce the risk of chronic disease has a place. Research has consistently shown that the Mediterranean style of eating is highly effective in preventing and controlling chronic disease, and it can be healthy and delicious. So what does it mean to eat the med way? The Mediterranean style eating pattern incorporates the basics of healthy eating that were traditionally practiced in countries that border the Mediterranean Sea. This eating pattern is based on how people historically ate in the Mediterranean region and is not necessarily reflective on how people in the Mediterranean currently eat. Following a traditional Mediterranean style eating pattern has been shown to promote health and decrease the risk of many chronic diseases. The key components of eating the med way are eating lots and lots of fruits and vegetables of all kinds of shapes, colors, and sizes. Eating whole grains, making most of our grains whole. Make beans and legumes your plant-based proteins a go-to. Eating fish and seafood at least 2 to 3 times a week while also decreasing the amount of red meat that you're eating. Eating nuts and seeds, they're high in fat, but most of the fat is healthy. Because nuts and seeds are high in calories, they should not be eaten in large amounts. For best nutrition, avoid candied, honey roasted, and heavily salted nuts and seeds. We want to replace solid fats like butter and lard with healthy fats, in particular olive oil. Using herbs and spices instead of salt to flavor foods. And we want to drink red wine in moderation, which is optional. The Medway also recognizes the importance of physical activity, enjoying meals including sharing meals with family and friends, and limiting the amount of sugar, particularly from sugar-sweetened beverages and added sugars in grain-based desserts. The Medway promotes the following superfoods: fruits and vegetables. Eating lots of fruits and vegetables is the cornerstone of healthy eating and the core of the Medway. Nuts and seeds. Associated with a decreased weight and chronic disease, nuts and seeds are included in the Mediterranean style of eating. The Medway also emphasizes eating whole grains. Olive oil and other plant based oils contain beneficial mono and polyunsaturated fats. Olive and other healthy oils are a key part of the Medway. The Medway also emphasizes plant based proteins such as beans and legumes. In addition, the Medway encourages eating fish and seafood on a weekly basis. The Medway limits the following foods that we know are associated with a higher rate of chronic disease and obesity. Sugar. We want to make sure that the diet is low in sugar, lower in red meat and processed meat, lower in saturated fats, so solid fats like butter and lard, and low in processed and convenience foods. The Medway of eating gets check marks all around for including the things that we should be eating, like the superfoods, and limiting the things that we shouldn't be eating. Eating the Medway is not about a flavor profile. Remember that the Medway is based on how people historically ate in the Mediterranean region and is not necessarily reflective of how people in the Mediterranean currently eat. As such, a modern Mediterranean flavor profile is not necessarily consistent with the Medway, so we need to keep an eye on that. Medway dishes can fit into any flavor profile: Italian, Greek, Indian, Mexican, or just whatever seems delicious at the time. Medway dishes are defined by the components that make up what you're eating, like high levels of fruit and vegetables, high levels of mono and polyunsaturated fats, just like we've touched on, but not by a dish's flavor profile. Taking this one step further, eating at a Mediterranean restaurant or something labeled Mediterranean is not necessarily consistent with eating the Medway. So eating the Medway is defined by the components that make it up. Again, like lots of nuts and seeds, beans and legumes, low red meat, low in saturated fat, not by a Mediterranean country's typical food or flavor profile. Typical Italian or Greek dishes are not always consistent with eating the Medway. Thinking about spaghetti and meatballs, which is high in red meat, high in white flour, meat kebabs, pizza, any of these things are not necessarily eating the Medway. Eating the Medway is also not about taking one component of the diet, for example, the olive oil, and adding it to other foods that are not consistent with the Medway of eating. So adding olive oil or Mediterranean flavors to something that was already highly processed is not consistent with eating the Medway. We want to make sure that we and our patients are focused on cooking and eating real food as close to its natural state as possible. So the magic is here. It's all of these things together. It's all of the things that make up the Medway of eating. These may not be the food guide pyramids you're used to. These Mediterranean-style food pyramids offer two visual representations of the Medway of eating. On the left, you see the ECU School of Medicine, the graphic, and on the right is the Old Ways Nonprofit Food graphic. Looking at either of these graphics, you see that fruits, vegetables, whole grains, and beans make up the bulk of the Mediterranean-style eating pattern there at the bottom. That's what you build every meal around. Nuts and seeds, olive oil, and herbs and spices are also part of that largest portion. Fish and seafood make up a smaller quantity, eat at least 2 times per week. Poultry, eggs, cheese, and yogurt make up an even smaller quantity, eat a couple times a week. Sweets and red meats are grouped together and they make up the smallest portion, eat very sparingly, so less than once a week. Sweets only once or twice a week or in very small portions, and no sugar-sweetened beverages, and red meat 1 to 2 times a month. Wine is in moderation, up to 1 glass a day for women, 2 glasses a day for men. Water is the primary source of fluid. Being physically active, taking pleasure in eating, and enjoying meals with others makes up the foundation of the Medway of eating. Here's another way to look at it. If you prefer the My Plate style, this is the healthy eating plate from the Harvard School of Public Health. It goes further than My Plate by providing a more comprehensive and accurate reflection of the best available research findings related to health and nutrition. The healthy eating plate here incorporates Medway concepts into the graphic, including fruits and vegetables making up a bulk of the diet. The protein comes primarily from fish, poultry, beans, and nuts, limiting red meat and cheeses, avoiding bacon, cold cuts, and other processed meats altogether. Making your grains whole, they specifically say whole grains. making refined grains such as white rice and white bread the exception to the rule or sometimes foods. Water or tea or coffee with no added sugar are the main sources of fluids. Healthy oils are included in the diet, such as olive and canola oil, making sure to limit butter and avoiding trans fats altogether. It's interesting to compare the med style of eating to other diets like the DASH diet because I feel like a lot of us were taught about the DASH diet in school. So, how does eating the med way compare to other evidence based eating patterns? The original DASH diet was lower in fat than what is recommended in the med way of eating. The new DASH diet is a little closer, though it's still not as high in healthy fat as to what we're seeing in the med way of eating. For the second time, the Dietary Guidelines for Americans includes a healthy Mediterranean style eating pattern, which has been modified to reflect the abundance of evidence supporting the association between positive health outcomes and the Mediterranean style of eating. When we say go med or eat the med way, this recommendation is largely similar to and consistent with other evidence based dietary guidance. Now that we've had a look at what the med way is, let's look at why you should go med. The Medway is delicious and it's evidence based. This photo is of delicious and simple oven roasted vegetables tossed in just a little olive oil and a bit of salt, and it's a great example of one of the reasons why you should go med. It just tastes good. But in addition to being delicious, studies strongly support the association between positive health outcomes and eating the Medway. We want to keep the next few slides in mind as we're looking at the basis for the PhytoRx prescription. So we're looking at this base Mediterranean diet and adding on that phytochemical bit specifically to the patient's diagnosis. So eating the med way decreases the risk of some forms of cancer, specifically colon cancer, breast cancer, and prostate cancer. Strong compliance to a Mediterranean style eating pattern is associated with reduced risk of overall cancer mortality by 10%, colorectal cancer by 14%, prostate cancer by 4%, and digestive cancer by 56%. Reduced risk of breast, gastric, pancreatic, liver, and head and neck cancer may also be associated with adherence to a Mediterranean style eating pattern. Eating the Medway is better than a low fat diet for weight loss and weight loss maintenance. And why is that? Well, past low fat diet advice did not account for the harm caused by starches and sugars added to low fat foods in place of removed dietary fat. Also, a low fat diet does not provide the same level of satiety as a higher fat diet, such as the Medway of eating. A greater level of satiety makes a diet or an eating pattern easier to sustain over time. We have to abandon the notion that we need to eat a low fat diet to maintain and or achieve a healthy weight. And this remains in the belief system of a lot of patients because of the low fat diet push of the 90s. Obesity is one of the leading public health crises of our time. It's connected to increased risk of chronic disease and illness, and it continues to be a challenge for many patients who struggle with weight loss and maintenance. Eating the Medway, so an eating pattern high in healthy fats, vegetables, fruits, and whole grains, and also low in red meats, processed foods, and added sugars, is better than a low-fat diet for weight loss, especially for overweight and obese individuals. Research has found that a higher fat Mediterranean-style eating pattern, up to 42% total dietary fat, did not lead to weight gain. We're still finding that nearly 9 out of 10 people are worried about consuming fat just as much or more than they were 5 years ago. So despite evidence supporting the benefits of an unsaturated fat diet, many people continue to worry about the general consumption of fat. Eating the Medway promotes brain health. So it protects against cognitive decline by protecting the small blood vessels in the brain that deliver blood flow to the entire cerebral system. Research has found a 40% lower risk of developing Alzheimer's among those who eat the Medway. Additional research studies continue to look at the protective effect of eating the Medway on a cognitive decline. So I've already talked a little bit about how carotenoids play a role in eye health. But eating the Medway in general may improve eye health, including decreasing the risk of macular degeneration. Eating the Medway may protect the small blood vessels behind the eye from damage associated with aging that can lead to compromised eye health and macular degeneration. Additional research studies continue to look at the protective effect of eating the Medway on eye health, particularly the possibility of delaying or lessening the impact of aging on eye health decline. Eating the Medway decreases the risk of type 2 diabetes. This is a huge one. The increase in type 2 diabetes is a major health concern in the United States, as we all know. Research shows that eating the Medway decreases the risk of developing type 2 diabetes. One study found that the risk of developing type 2 diabetes was cut in half, a 52% decrease, by eating the Medway. Why? The reduction in type 2 diabetes was partially due to the decrease in body weight resulting from the Medway of eating. However, the Medway of eating was also found to have other protective effects that help people to avoid the development of type 2 diabetes. And we've seen some of that with the anthocyanin talk. Eating the Medway can also help our patients manage blood pressure. High blood pressure is a known risk factor for developing cardiovascular disease, of course, and eating the Medway can help reduce high blood pressure, mitigating the risk. Most of the research around the Medway of eating has examined its impact on cardiovascular disease. We know from a variety of studies that eating the Medway can reduce the risk of CVD as much as 30 to 60%. Full adoption of a modern version of the Mediterranean eating pattern can be considered one of the most effective approaches for the prevention of fatal and non-fatal CVD complications. One study found that consuming 9 or more servings of fruits and vegetables a day resulted in a 60% reduction in CVD. So the takeaway is that a diet high in fruits and vegetables is important for reducing the risk of cardiovascular disease. So now that we've talked about what the Medway of eating means and the science behind it, let's review what eating the Medway looks like. The components of eating a Medway are eating lots and lots of fruits and vegetables, eating whole grains, eating beans and legumes as part of plant-based protein, eating fish and seafood at least 2 to 3 times per week, snacking on nuts and seeds, but being careful to limit quantities, replacing solid fats with healthy fats, including olive oil, using herbs and spices instead of salt to flavor foods, and drinking wine in moderation. Also recognizing the importance of being physically active, enjoying meals together with family and friends, and limiting the amount of sugar, especially from sugar-sweetened beverages. Eating the Medway is simple, delicious, and satisfying. The Medway uses simple ingredients and simple food preparation techniques. It uses healthy fats, spices, herbs, and aromatics to make the food delicious and craveable. The Medway also uses foods that promote satiety, like whole grains, vegetables, fruits, nuts and seeds, and healthy fats. A little bit more about the mindfulness piece of the Med Instead of Meds course. Eating mindfully means eating with awareness of what's on your plate and also of the entire eating experience. Mindful eating is being present in the moment and enjoying every aspect of the meal that you're eating. During the rest of this course, we will focus on the 7 steps to eating the Medway. During each of the steps, we will explore 1 to 2 ways to help your patients learn how to implement each of those steps into their lives.